Hello, welcome everyone to today's Prevent Connect web conference, Using Essential Elements to Select, Adapt, and Evaluate Violence Prevention Approaches. I am David Lee and pleased to have all of you from all around the country joining us for today's Prevent Connect web conference. I know we've had from Alaska to Florida to Miami, so we've got the full cross-section in that direction of people joining us. Thank you for joining us for this very important topic. This is a topic that for me is very important, and I'm very excited that we're presenting about it. I've been in conversations with the Centers for Disease Control and Prevention about developing an adaptation. What we originally discussed was an adaptation guidance many years ago, and as this new document has been released, I really feel this is going to be a very useful tool for prevention practitioners, and so it's really important. So our learning objectives for today is that we will have all participants identify 3 types of essential elements and considerations when estimating these elements. We'll be able to describe in our approaches essential elements we use to decide which approach to select and guide delivery once selected. And then you'll be able to identify 1 to 2 examples of how to make adaptations that maintain essential elements of an approach while effectively responding to local opportunities and challenges. That's what we are intending to be able to have you get as your outcome today. With this, the CDC recently released this report, Using Essential Elements to Select and Adapt and Evaluate Violence Prevention Approaches. You do see the URL on the screen. Megna will also post that URL on in the text chat, and so this is a great way, a great resource that's being available. So I want to get a sense from you. I'm going to put this in the lower left-hand corner in ABCD feedback. How familiar are you with this new guide? So A, you've not heard about this guide before the web conference was announced, or you heard about it. B, you heard about it through some type of announcement. C, you've actually reviewed this. And D, you've actually used this guide already. So go ahead, and we're having people go ahead and voting. I still see there's 100 of you who haven't yet, so we've only got 2/3 of you who have. So go ahead and keep on filling this out, and I'm going to now share the results with all of you, and that we can see that about 2/3 of our audience was not familiar until we announced the web conference. So I'm really glad that we did that. And that about 1/4 of you heard about this through partners' announcements as it came out, and then obviously we're thrilled to see the web conference to learn more about it. And we even have a small percentage of you who have reviewed this, though not very many, and I even have a few, 1 person who has actually used the guide. So I don't know who that person is, but it's great to be able to have someone who's used that. Our hope is that by if we ask this question in several weeks, then many of you will have said that you've used this guide and found it helpful to advance your prevention experience. So with this, I'd like to introduce our presenters today from the Centers for Disease Control and Prevention from the Division of Violence Prevention. We are very happy to have joining us Kimberly Ferrer and Meredith Stocking. So how are you doing, Kimberly?
Doing well. Thanks, David. It's good to be here.
Wonderful. Great, and Meredith, it's great to have you joining us today also.
Thank you. It's a pleasure to be here.
So what I'm going to do is hand the podium off to Kimberly. I did it. I'm going to hand the podium to you, Kimberly. But we're going to ask the audience question first, just to get this started. And so, Kimberly, this is actually a really important question from our audience. Why is adaptation important for prevention practice? So we want to hear from all of you. Why is it important for you? I know that's why there's so many people attending today's web conference. Why is adaptation important for prevention practice? Why is it important that we can be able to do really the highest quality adaptation of prevention materials? So go ahead and write in the text chat. Megna will be putting the question in the text chat, but we want to have you join us, and I realized people are already, Megna already posed the question, and so one size does not fit all, because society grows and changes with each new generation. To foster innovation, Every community has different needs. My community is different than your community. Our communities are different, so there's different cultures. We need to be relevant to the population we're serving because our audience is ever changing. Because all solutions do not fit all clients and all programmings don't do it. Cultural considerations. We need to build our own resources, particularly those that are going to be relevant to it. We need to, in a small place, you have to think outside the box, but you also want to get the best thinking to encourage cultural humility and build relevance to the strategy to the community which it's implemented. Every situation is unique. Help understand this and about being cultural competency. So I see some themes here, Kimberly. A lot around cultural competency, a lot around how do we make sure we meet the specific needs, and I think a really interesting theme about how things are changing and that what worked, what we developed 10 years ago or even 5 years ago or even 3 years ago might not be relevant today. And so I think those are some of the themes that I'm seeing that emerge in this. So thank you, everyone, for sharing. So Kimberly, I'm seeing a lot of people that see the importance and the value of prevention practice.
Yeah, that's great to see. And I think that when we started on this journey a few years ago, and Leah Perkinson, who's not on the call today, but she's the lead author of this guide, and with the Robert Wood Johnson Foundation, we realized that whether it's funding agencies or technical assistance providers, people on the ground, implementers, and developers, we were all really grappling with the issue of how do we take a program or other types of prevention strategies to different contexts. And so that's really kind of the crux of this work. And what I'd like to do, thank you everyone for sharing. I think your observations, many of them touch on themes that have come out of our work on what we, as David mentioned, in the beginning used to call the Adaptation Project, because that's how it started. And then I think it's evolved over time. We've really, we realized in doing this work that it wasn't just about adaptation, it had to do with other kinds of implementation components, such as selection and evaluation. So what I'd like to do, and David, thank you so much for that great setup and getting some energy going through the chat box. What I'd like to do is just to share with you a little bit about the history of how this guide came to be and our work with all of our different partners. And Leah is with us in spirit, even though she's not here in the room. And then kind of talk through the different sections of this guidance. So we've done previous webinars, including on Prevent Connect with our various grantee groups, where we get more into kind of the applied examples, and we will do some of that today. But our main goal really is to kind of, again, give you the background and go through the guide itself. So here you can see the goals that we had with the Adaptation Project. I think really relevant to some of the comments in the chat box is one of the goals was to examine perspectives of multiple implementation stakeholders. What we found when we started out is, at least in published literature, the majority of this literature really was representing one perspective, and that was the perspective of developers or program developers or kind of the original innovators, and wasn't necessarily including implementers, people who provide technical assistance, or funders. We were interested in identifying the types and reasons for adaptations made during implementation, particularly for violence prevention strategies. Of course, that was our focus. And then as part of our work and our kind of the crossover between the work we do with quality improvement and our interest in understanding what implementation looks like on the ground, we wanted to facilitate what we call feedback loops, which was really mostly stakeholders talking to each other and offering their perspectives and reflections on what we were learning. And we wanted to do this among our various implementation stakeholders to advance implementation goals. So overall, we had a couple of guiding questions. because I think one of the things that we found, particularly in our scans of other health topics like HIV, reproductive health, substance abuse, that there was just such a massive amount of information to consider. And we really wanted to get to the heart of which adaptations are really consequential. And for us, consequential meant they were important, important because they might impact outcomes, or important because they might actually impact the adoption or uptake of a prevention strategy. And also, who decides? So again, historically, the perspectives of developers have kind of been the dominant perspectives. And so they have weighed in on what is important, what is consequential. And we were interested in bringing together these other perspectives to kind of examine, which types of adaptations are most important and which ones might actually be most important for different stakeholder groups to weigh in on. Okay, great. So with that, before I launch into talking about the project itself, we've already used this term essential elements several times. And so I want to define it here, and then we'll come back to really talking about what we mean. Essential elements, by essential elements, what we really are talking about are the active ingredients of a prevention approach that are assumed to be responsible for achieving the intended outcomes. And as many of you know, for a lot of prevention strategies, it's really hard to disentangle all of what those active ingredients are. And so often these aren't necessarily things that have been individually tested within a particular prevention strategy, for example, in a research study. But what we're going to lay out today is thinking about really a practical approach using the best available information to guide implementation decisions. So that essential element and what this guide really is intended to help practitioners walk through is what are the assumed essential elements based on information available. So a little bit more about the project. We actually had a number of stakeholder groups who we engaged with. Of course, foundations, Robert Wood Johnson Foundation was our funding partner. Our program grantees, in particular, our STRIVE grantees who work in youth violence. A number of our federal sister agencies, as well as the Parent Training Institute out in San Francisco, which is part of the health department there. We had technical experts that we worked with to help us with some of our studies of adaptations and implementations, of course, our national partners, including Prevent Connect. And we worked very closely also with Futures Without Violence, as well as some of our research, our academic partners at University of Pittsburgh in Michigan. And really what we engage with these partners is to really consider these four things. One is within the context of the prevention strategies that they were implementing, and we actually looked at 3 specific strategies: Coaching Boys into Men, which was developed by Futures Without Violence; Youth Empowerment Solutions, which was developed by University of Michigan; and Triple P, which was developed by Matt Sanders in Australia, but being widely implemented by the Parent Training Institute. Our goal was to identify their essential elements, to track and study adaptations. So we didn't actually fund implementations. We went into different contexts where this was already being implemented to get a sense of what this really looks like on the ground, and then to work with our stakeholders to interpret findings and apply them to implementation. And toward the end of this web conference, I'll share with you some of the things that have come out of that. Finally, I want to, before I turn to talk about the guidance itself, I just want to distill kind of 3 main information streams, or 3 lessons we learned. And there was so much that we learned, but really, I think if I were to distill it down to 3, and it came from really examining these different perspectives, assessing adaptations, and then applying essential elements, which we really looked at closely in the context of this project across programs, but applying it to other types of strategies. So I think the three takeaways that we really have integrated and applied in this guide is there's as much to learn, and some might say even more to learn, from implementers, or you could think of them as early adopters, those that are implementing prevention strategies. There's as much to learn about how a prevention strategy works from them as there is from a developer. So I think we were really encouraged that by engaging these various stakeholders, we actually learned a lot about what really makes prevention strategies work. We also found that by studying adaptations, you can learn a lot about the essential elements of a program, in our case, or other types of prevention strategies. And I think this is really important because it's what we know to be true is that in order for this work to actually get traction and proliferate and really grow, we need folks on the ground, organizations on the ground who are doing this work, and that we already knew from our previous work that adaptations happen. So to be able to harness what we can learn from that and apply it to this was very encouraging. And then finally, we learned that the same frame that we were really, or traditionally has been applied to programs, can be applied to other types of prevention strategies that certainly in our division that we implement. So what we're hoping is we develop this guidance, and then moving forward that we hope that you and others will use this in practice, that you'll find it useful. So turning to the guidance itself, the guidance has 6 sections. Each of the 6 sections is about 2 to 4 pages, and then in the appendix there are companion worksheets. So I think what we found in doing our environmental scan of adaptation guidance is there were kind of 2 extremes. One was extremely detailed evaluation guidance, which was also extremely voluminous. Many, 100 pages of guidance that was very specific and probably very helpful in responding to particular adaptations, but not necessarily manageable in terms of the amount of information. And then we also found in the other extreme that there was very general guidance that I think the trade-off there was there sometimes was not enough specificity for the practitioners we worked with to know exactly how to use that to navigate some of the decisions that they had to make. So our goal and our attempt was to try and strike some balance. And so I just do want to point out that this is not necessarily a step-by-step guide, but I think what it attempts to do is at least lay out through these kind of explanation of the concepts and then application through the worksheets. I hope it provides a starting place for practitioners to make decisions to think through some of this. Okay, so the sections that we have here, I'm going to go through each section actually of understanding evidence-based approaches, understanding essential elements, and then estimating essential elements, using essential elements to assess fit and guide selection, and then talking about how we use it for delivery and adaptation, and finally tracking and evaluating adaptations. So I'll start with understanding evidence-based approaches. And what we mean by evidence-based approach is, as we define it in the guide, is really evidence-based approaches for preventing violence. It includes a range of programs, policies, and practices that are intended to influence risk and protective factors at the individual, relationship, community, and societal levels. So I think the bottom line there is that it isn't just one thing or one way of doing things. We really think of this as strategies across the spectrum and across different levels from individuals to society that can address important risk and protective factors. And one point I want to make just as our entree into thinking about essential elements as a way to guide this process is a lot of folks will be familiar with this, and this is a very generic version of a logic model. And of course, logic models can help us think about the internal logic of how a strategy works, how it links, how approach activities or program activities in some cases are linked to short and intermediate outcomes, which we talk about as risk and protective factors. Long-term outcomes are then in turn linked to risk and protective factors. When we talk about essential elements, we really are doing a deeper dive, and this red circle here is around the approach into the activities and looking at what are the characteristics of these activities assumed to be kind of the active ingredients again. I want to point out that as we all know in the field of sexual violence and intimate partner violence, we sometimes use the label best available evidence versus evidence-based because we really are talking about strategies, and in this image we have CDC's technical packages, which I hope that you've seen, and if not, I would really encourage you to take a look at it. I think it embodies what we're talking about here, are strategies across the spectrum that have some support, and that support may vary in the strength of the evidence available, but certainly after examining different types of strategies sort of met the criteria to be considered in the package with the label of best available evidence. Okay. I'm now going to turn to the second section called Understanding Essential Elements, and I already really talked about what we mean, again, in defining essential elements as the active ingredients. But let me further define it and then talk about what we mean applying it to both programs and other types of strategies. Essentially, essential elements, or basically essential elements, we think of as the what, how, and who of prevention strategies. So really what is essential, and I want to note here that if you've worked in other fields or even in this field, you may have heard the term core components or core elements. That is a similar concept. Essential elements in our project we use both because through feedback with our stakeholders and implementers, but also core components sometimes has the meaning or connotes something that has been empirically established. So we wanted to distinguish that, again, this practical approach. And it really is defining what is delivered or what is essential to be delivered, how is it delivered, and who delivers it. And what you can see here in the two Venn diagrams, someone once told me, really important presentations, you have to have at least one Venn diagram, and we have two here. So, so I hope that's impressive. But I think that the takeaway here is this is really laying out the application of the what, how, and the who. And you can see on the left Venn diagram, essential elements of programs. The what includes things like the knowledge and skills and messages that are delivered through program activities. The how is often the instructional methods, setting, and timing of activities. So really the delivery component. And the who really refers to the characteristics of the person or the organization, the entity delivering the program. In a very similar way, we found that we could use essential elements to also describe the what, how, and who of societal, community and societal level approaches. But the what, how, and who look a little bit different when you're not talking about a manualized program or a set curricula that has a manual that goes with it that lays out, for example, knowledge and skills. As you know, a lot of our strategies really are intended to influence other types of factors other than individual level characteristics. So here we talk about the what, which may be, for example, in a social media campaign, the key messages. Or an environmental strategy, it may include design elements, for example, crime prevention through environmental design or SEPTED. Or for policy work, it may include some of the key components for that. The how may be a little bit more broad, including guiding principles, implementation methods, and processes. And the who, really what we found is not necessarily a single implementer, but the characteristics of leaders, partners, and stakeholders implementing the approach. Okay, so moving on to estimating essential elements. And once I talk about the highlights of this, I'm going to talk through an example and how we actually apply this. And then we will come back shortly after that to having you engage a bit on the text chat. So estimating essential elements, we say estimating because I think it really is just that. It's an estimation based on the best available information. And I think we are going to mostly show as our examples the application of this to programs, but you should know that in the guide we apply this to not only programs but to community and societal level strategies. Here's an example of some of the considerations when estimating essential elements of programs. And I want to make the point that this is not necessarily an exhaustive list, but it does come directly from studying adaptations and implementation, and as well as studying in other areas, other health topic areas, what they often define as core components. So we lay out in the left-hand column what are some of the essential elements by the what, how, and the who. For example, in programs, often what's essential is building knowledge of topic areas and building skills. We talk about why are these essential, and an example would be for building knowledge of topic areas. Activities in many programs are designed to communicate key messages to increase knowledge and understanding. And then we provide examples. This is really, again, based on lessons that we learn from common adaptations. And I think it might be helpful to talk through, well, what does that really mean? It sounds to me in the beginning like it could be quite a daunting task to think about, I'm going to estimate what's essential in a prevention strategy, or to think that that's really something that would even be appropriate to do. But I think if we talk through this example and how we've applied it, it may become a little bit clearer about what we mean. So this example is really comes from a workshop that Leah Perkinson did with one of our rape prevention education grantees and actually the organizations that they fund. I want to make the point, I'm going to use the example of safe states, but this is in no way an example of, this was not a safe states training. This was a training around trying to take evidence-based programs into the different contexts within the state and actually using the essential elements framework to do that. So safe states is really just the example in doing that. So this table here shows you that the essential elements of what, how, and who. And essentially, this was a 2-day workshop where the organizations that were being funded were all being funded to do the same strategies, one of them being safe states. They came together, they all worked in different communities, and went through a process of estimating essential elements. So what I have in this table is the what, how, and who, and then the focus for the safe states assessment. So for example, for the what, really we're talking about messages, knowledge, and skills. And I think I'm making an assumption that everyone knows what safe states is, but for those who may not know, safe states actually is one of the oldest, earliest to be developed in this field, teen dating violence prevention curriculum. It was developed in the late 90s. And it has 10 sessions, it has role plays, and then it has some activities including a play at the end. So it is sort of what we think about as your traditional curriculum that is focused on preventing teen dating violence, promoting healthy relationships, and also promoting skills around communication and conflict management. So the messages, knowledges, and skills are important. The how really were the focus were instructional methods, the delivery timing, the session sequencing, and the setting. And the who, really the focus for that were what are important characteristics of facilitators. There was a lot that went into these 2 days, and I really am distilling it here to its essence, but essentially what was used to inform these for the what were a review of the stated program goals and session objectives, which are actually provided by the developer, as well as the program logic model. So that was to really draw out each session had objectives and had the key messages, and it was obviously a very strong indicator of the what. For the how, the implementation guidance in the curriculum certainly provided some information about delivery, but this was where practitioners really provided input about their specific context and settings. For example, some of the how had to do with the age groups that they were implementing with and the timing that they had for school, being implemented in school. So the setting itself and identifying the session sequencing, which actually came from the guidance in the curriculum. The list of common considerations for curriculum delivery we actually brought to the table with the work that we had done on adaptations. And finally, the who, the important characteristics of the facilitator. So the implementation guidance in the curriculum provided a little bit of information, but what they spent the 2 days talking about, and what I'm going to show you, is identifying the skills related to delivering the content. So once the how, the what and the how were laid out, it was easier to be able to lay out what are those key skills, and that was also informed by input from practitioners that actually had a lot of experience implementing different kinds of strategies. So here's what resulted from this process, and I'm going to focus on estimating essential elements for implementers. The group basically went through the worksheets and distilled these essential characteristics. One, to have a clear understanding of the themes and messages of safe states. To show a genuine interest in the participants' lives and ability to relate to them. So the first one I just mentioned is probably, you would say, common sense. You have to know the program, and that's part of this training. The part that has a little bit more about the spirit of how this is interest is the connection to the participants, which is not as well articulated in the curriculum itself. To demonstrate a commitment to students and to the program by finishing all sessions. So that has to do with kind of the full implementation. Also that implementers need to maintain order and keep class on topic, foster a safe and non-judgmental environment, and are excited and enthusiastic about the material. And then there's a note here, this will translate into enthusiasm in and engagement by the students. What I thought was really helpful about what they did is they also identified what characteristics do not support these essential elements. And these included things like implementers that don't believe or facilitators in what they're doing or don't actually practice the values they're teaching, and not aware, and in particular, I think this refers to really not aware of issues that impact the youth that they're working with, have an attitude of knowing everything or not being willing to learn or to relate. So in this particular context, this was an initiative that was really about rolling out, probably for the first time, an implementation that where every agency was doing something in common, and implementers really needed to be willing to engage and learn. So with that, I will wrap up, and I know that's a lot of information to talk about the estimation, and we can talk more about some examples at the end. But I'm going to turn to now using essential elements to assess, fit, and guide selection. And let's first have a text question. David, are Are you announcing?
I'm right here. So let's hear from, so that was a lot of really interesting and important pieces. So sort of going back to having everyone on the phones, how do you decide that a prevention strategy is a good fit for your context? We mean by context, we mean the community you're working in, the particular settings that you're doing. There was lots of discussion already in the text chat about, every individual has their own culture. But how do you decide that something is a good fit? So what are the ways that you, as a prevention practitioner, know that have indicators that something is a good fit for the context where you're doing your prevention work? So I'd love to hear from you. Let's think about this and go ahead and write in the text chat how you think that a prevention strategy is a good fit for your context. So participants get excited and give positive feedback. And so there's that response, and that positive response and getting feedback is one way that people do it. Another way is discuss different issues. People write in, it shifts on my page. Discussing the different issues that are in the different schools and how they fit to the schools so that you know that you're doing different pieces. If people interact, and so often the interaction shows that engagement is an important piece. Feedback in previous attempts, look at the history, so you look at what you've done before, what worked and what didn't work. You compare prevention programs to the audience with who's participating. So the audience will tell us, I'm seeing a lot of pieces that's been implemented in similar populations as yours and shown to be successful. So looking at how people have done that there includes stakeholders. Participants report not just recall and recognition, but integration. And you hear about challenges of those facilitated, using needs assessment, feedback panels, surveys, collaborate with partners to get the input, so it's not just you. There's rarely prevention strategies that have been adequately tested or documented in our API communities. So we start with what is the need, what fits the resource that we can bring, and how much flexibility is there to adapt to the specific context. So then it's interesting to know is how do you know that your adaptations are going to fit is a really great question. Language, ideas, concepts accessible and relatable. So I see, Kimberly, a lot of the audience internalizes the concept. So a lot about how the audience does it, responds to is a real common theme that I'm seeing, and there's also some about the intentionality that people have put into the preparation of understanding what those needs are of the community and being very thoughtful, intentional about. Those are some of the themes I'm seeing in this, Kimberly.
Yes. Thank you, everyone. I think that this really dovetails with the way that we have been thinking about this, and I mentioned that originally we were really focused on adaptation, but what we found is that essential elements really helped with assessing fit, and Meredith in particular kind of worked on developing this piece. Because if you think about it, adaptations often come from things that might be considered a poor fit versus like a poor fit for the context, versus some other types of adaptations may come from just practical considerations that come up during implementation. So I think that I really appreciate people's reflections, and there are a couple of other things that that came up that you mentioned, David, that I'll touch on in a moment. So the section on assessing program fit, what we found here is once practitioners understand an approach's essential elements, that they can better assess the extent to which the approach is a good fit for their delivery setting or context, and identify the types of changes that can be made in the approach to increase fit. And in particular, we all know that when we're implementing different programs, particularly when they're funded, whether it's by a federal agency or a state agency, there's often requirements that come with that, such as needs and assets assessments, capacity assessments, thinking about community readiness, as well as doing an environmental scan of what's happening. So what we found is in practice, actually, there's a lot of information practitioners already had that they could use to think about fit, and that there's several aspects of program fit to consider, and that essential elements kind of worked well for this. So, for example, for need, the question is, does the program or prevention strategy adequately address the problem the community wants to address? Or does it actually build on the assets the community wants to focus on, for example? And is this an added value to the community? Thinking about the values and the culture, a few people touched on that. Really, this is a way essential elements can be used to see if the prevention strategy matches the values and preferences of program implementers, for example, and that often can come out in a needs and assets assessment or even a readiness assessment, as well as the program participants, the larger community. Thinking about resources, often that comes through in capacity assessments, for example, or other types of information collected. Being able to assess our resources available for the adoption of this strategy and implementation, as well as thinking about skills, and in particular skills of those working on the implementation. Or are these things that need to be developed? So we sort of formalized this a bit in thinking about, and this is what you see here is the worksheet that we have for assessing fit for programs, as well as community and societal approaches. And this really gets at some of the things that can be considered for fit in the language that we use, at least here at CDC, where we talk about risk and protective factors. So you might think of fit in terms of fit for the community. You might think of it in terms of, is it addressing these risk and protective factors? And that might be for the program, obviously, the knowledge and skills, or for other types of strategies, the messages, are they really consistent with the messages that we are trying to develop in our larger community work? Similar for the how and the who. And again, the idea is that there's often a lot of information that can be applied, but this worksheet can also help practitioners identify what other information would help us inform whether or not this is a good fit, including thinking about the specific resources that are needed, or is the setting that we're considering really appropriate. This comes up often in folks making decisions about whether implementing something in school or outside of school, given both just the context of being in school, but also the timing considerations, I think, and environmental strategies. Often we think of considerations around really being a safe environment for youth, for example, to have the kinds of discussions that are sometimes promoted through various strategies. So this is what this worksheet is intended to help with in assessing fit. And I think what's important, and I want to point out here in the guide itself, is we recognize that a lot of times folks are coming to this after a strategy has been selected, or they've had, they have to select off a list. So we really talk about, if it's before an approach has been selected, the practitioners can use the essential elements to determine a fit between the approach and the delivery setting or context, and the people who are involved in that context. And that might actually be more help with actual selection. But maybe more common in some contexts would be after an approach has been selected. But the essential elements and the framework we use can still be helpful in assessing fit. And this really flows into the next idea of adaptation.
So, Kimberly, I just want to really highlight the usefulness of this tool, of this worksheet, and I really encourage people when you look at the guide to see the worksheets, because it helps really think about how to concrete look at it, whether, as you say, whether it's selecting what intervention to do, or if you have an intervention that you've been working with, to be able to figure out how you're going to do a better job of having it become a better fit for your community context. So I think while this was designed specifically for people in selecting it, I think it's helpful for people in all those different settings.
Great, thank you, David. And in the section itself, we also have considerations when assessing fit, not that are beyond what's here in the table itself. So we hope that it will be helpful regardless of where folks are at in their selection. Okay, so moving right to delivery and adaptation. And I think this is, what we really thought in the beginning was the heart of our work, the core of the work. And it certainly is where we devote probably most of the space in this guide. But I hope when we get there, you can see why all of this buildup in thinking about essential elements really is kind of the basis for making decisions about adaptations. So I'm excited to get there momentarily, but first, let me turn it back over to David.
Okay, so let's come up with some concrete examples. So can you share situations come up where you've had to make a change or an adaptation to a program that you have? So thinking about some of the examples that you have, we just want to get a sense of the range of types of places where situations that have come up for you where you've had to make a change or an adaptation. So we want to hear from you and get a sense of what some of those situations are. You've talked about why already, why the need for adaptation. You've talked about why people have already addressed how they know something's a good fit, but I'd like to get a sense of some example. Here's one that comes up in many different places I have heard. The school won't let me see the word gender or discuss gender stereotypes, and so I have heard that. And some people are figuring out how to change this font size because it is small, but there is a way to do that. But let's go ahead and get some more people of what are some examples that you have of where you need to make a change or an adaptation. I think a common one, and we saw recommended earlier, is programs that might have, for example, the example was given earlier about API, Asian Pacific Islander students, and that they're, it just disappeared. Did it disappear on you? Okay, well hopefully we'll be able to keep that. So, but people are still writing in, so we'll be able to do that. So some examples of some curriculums that have a set length and you can't modify it, you can't present to certain groups. Sometimes you have the length of time of doing it. And then with risk factors are slightly different, you do adjust our, for example, young adults with cognitive disabilities, so we had to focus more on power and control. Some assume that all relationships are heterosexual, so we need to be able to make adaptations to make sure that we're going to be inclusive. People are writing in quickly now. Students felt that the names for people in scenarios felt racist, so you had to adjust the names of what the examples were. Using middle school curriculum as an immature group of 7th graders, you had to make some changes of how to meet where they were, and you might also have a 7th grade group that's very sophisticated that you need to make changes to. We're making sure that we're including LGBTQI relationships and making sure that that's there, and it's not just by doing it, but making sure you're moving forward. Special education youth around disabilities, I'm seeing much theme. So if you're doing this after school programs, there's adaptations you need to make that different. Sometimes they won't come if it's called the Dating Violence Prevention Program, but if they do it if it's framed as healthy relationships. So those are, Kimberly, a lot of really good examples that people are sharing.
Yes, definitely. And I think, Meredith and I are looking at these, and I think we resonate with. These are things that I think roll up into some common categories of both what practitioners encounter in trying to implement and to respond to what's happening in their context. So thank you, everyone, for sharing. Let me, and they keep coming. Yeah, please keep, even as I'm talking, sharing your examples.
And I encourage people to share their examples, because as Prevent Connect is continuing and also as CDC is looking at this, if there's examples here, these are ones that we'll be looking at how we can help support and coming up with programs that will address some of these examples that you're talking about, because they're really important. You know, says I'm seeing a lot of theme about making sure that we're really addressing LGBTQ plus communities, and Prevent Connect did some web conferences in the last year around how to be able to do around some of those issues in prevention programs, which we would consider adaptation. Sorry, couldn't help sharing that.
Yes, and just one final reflection here is it kind of comes back to where we started when I talked about kind of our guiding questions of, you know, which adaptations are consequential, meaning they're important for, and what many folks have pointed to is important to be relevant to the context for people to really want to adopt the idea. They can also be important because they might impact outcomes, and that impact may be related to you know, the difference between being able to engage a group. I love the example of the 7th graders. You know, and a lot of the work that we've done is kind of developmental types of adaptations have been really important, and we've done work in working with both developers and implementers on that. So I think that this is really where the rubber meets the road in terms of, you know, practitioners, implementers in particular, you know, being faced with situations in their context where we have to make decisions. And, you know, the example of names is, I think, a really good one, because I can't tell you how much time I've spent and others have spent in other agencies trying to respond to things like, is it okay to change a name? Or is it okay to change things that may or may not be essential to the overall message? But because of this idea, and this is a good segue to thinking about what has been called Fidelity, and in many contexts that's been really defined as, you know, implementing a program in particular as intended, and that's often been interpreted as exactly as it was originally implemented, meaning all of the activities really mirror that original implementation. We defined, and we talk about finding the balance in fidelity and flexibility. So really thinking about it through the lens of essential elements, we define fidelity as maintaining the essential program elements, and balancing that with flexibility, which is really allowing for adaptation. And I think from our perspective, you know, there's it's really hard to kind of strive towards some idea of perfection, but I think we really do believe that there is true balance that can happen when thinking about this idea of maintaining essential elements while at the same time having that kind of flexibility. So that takes me to the adaptation section. And what I want to say here, I'm going to talk a little bit about what's in the guide itself. First, I want to share with you what you see here on the screen, is that we use a traffic light as the metaphor or the framework that can help describe whether an adaptation likely supports essential elements or does not. And we talk about red light, green kind of meaning go, obviously, or likely to support essential elements, and red, likely not. This really, again, is the guide takes practitioners through a process and provides some tools to help make decisions. So this is in absence of definitive information on, you know, does this adaptation actually impact outcomes that may or may not be available, that kind of information. But there's a lot that can guide that, including this defining what is essential, and would this adaptation actually change that thing that we've now defined as essential. People often ask about yellow light, and I will say in practice, when yellow light is available, almost everything is a yellow light, because I think it's human nature, and particularly people who are constantly working in problem-solving situations can see things, on the one hand, it may undermine something on the other. It's probably better to make the change anyway. And so it's easy to push everything into that yellow light. So we do talk about it in the guide and what some examples are, but the whole purpose is to provide some guideposts, for making a decision about we're going to make the change or not. That's why we don't actually have it in our worksheets. The last thing I want to say is this really came out of the guidance, our study, again, of adaptations that were being made and what were some of the most common ones and the reasons why. And we found that the most common reasons, well, first of all, the most common adaptations really were to delivery, and that's the thing that practitioners often consider the most, which was kind of interesting, particularly because content often, that's sort of the heart of the messaging part, but the focus often is more on delivery, which speaks to the adjustments to the context itself. We found, I'll just mention kind of the four most common. Adaptations were made to increase relevancy of material or participant understanding, to increase actual participation in activities, or to create or maintain relationships, and to respond to some of the practical constraints. And those may be things you've heard before, but we actually found that to be true. Understanding that this may be hard to see, I think Meredith has posted the guide itself, which is available online and is currently being published, will be available in hard copy. But what this shows are some considerations around whether something may be a red and green light. And it really flows from how we defined earlier in the guide, the what, how, and who. So I will just go through the example of the what and read here what is there. So the essential element under the what, the example is the session should increase an understanding that violence is a serious problem. And the adaptation is the implementer changes a brief lecture about violence into group conversation. So we say this may be a green light if key messages and activities about violence are still delivered through that conversation or discussion, and the discussion is well managed. And this is actually a real-life example. It may be a red light if participants are talking over one another and the key messages and activities are contradicted. So the real purpose of it is that these messages are delivered and then reinforced. And the delivery may seem appealing because it might engage participants more, but if the messages are lost, that's the idea. So we walk through a number of these examples for the what, how, and who, and we also do it for community strategies and societal strategies. So I think this is where in the worksheets that follow, or that are the companions here, it really helps to bring together what has been laid out with the essential elements, so looking at the what, and adaptations under consideration. All right. With that, I'm going to turn it back over to David, who is going to lead us into the final section of the guidance with a chat question.
And I have to say, I'm loving the chat questions. There's a lot of great examples, and I'm really curious learning more about the work that each of you are doing in some of the adaptation pieces. So we've talked about making some of these adaptations, but then it's not just about making them, but you have to be able to know what you're doing. And I think this is one of the big differences of what this process is that we want to be able to do it in a very intentional, thoughtful process, and how we track that implementation. So we want to know what your experience is as you make changes. What are some of the challenges you face in tracking implementation? How do you what are some of the ways that make it able to track how you implement your programs? What are some of those challenges? If you're going to track how the work's done. Often we've developed a program, but then how do you track how it's actually being done? What are some of those challenges that you have in being able to track how it's being implemented? So I want you to go ahead and write into the text chat We do have slides. They're on from today. They're right now on the Prevent Connect website. We'll post that later. But we want people to write down your experiences of tracking implementation and what are some of those challenges. Consistency with everyone in the agency is in tracking the same way or even at all, so you have different people doing it. Getting staff buy-in without adding to their workload, because if someone's doing 5 presentations and then you have to do the tracking guide, I understand the pieces. We want educators to be flexible and creative, so Fidelity isn't strong. However, we don't have enough staff to supervise or observe to keep track of what's being used. So I think that's one of the pieces that we want to build the strength of flexibility, but then need to make sure how you're moving forward. You need to train the volunteers to be able to do the tracking, and it's part of that system, and coming up with those systems I think is also in place. So much of our systems are paper and pencil, and all is to be input by hand. Which then connects to, we need a good database. And then how do you get it into the database if you have it? Here's not a prevention example, but tracking domestic violence advocacy by police precedent, challenges in protecting victim personnel information. So it's not necessarily a prevention piece. The anti-technology staff members. So sometimes people don't want to use the technology that's there. There's sometimes a little interest in objectively tracking because they already know how well it's working and they finding the feel-good assumption. I think I've seen this a lot. I know it works, but then we really want to be able to think about how to be able to do it. There's so much work and not enough staff, and then there's the follow-through of the partners. So these are all ones that I've experienced from my work. And this one's really important, Kimberly. Not always sure what to track and trying to figure out what the right parts are to be able to track. So, and then trying to get everyone to follow the same protocol. So Kimberly, let's talk about tracking.
Okay, great. I'll also say that this mirrors a lot of what we've experienced, and certainly what we've experienced through our grantees and kind of the practical circumstances of tracking. So I would like to, there's sort of 2 things before I start off. One is, I think this is the part of the work that I just will acknowledge, even in our environment, and I'm an evaluator, and I think tracking is extremely important. There really are trade-offs in timing, or time considerations, and I think we recognize that, and what we found is that I would say organizations probably find different strategies that work for them, and what we've tried to distill in thinking about this is, again, that question of what to track and what is helpful. So what we found across the implementers we studied, or the organizations, is there are different ways that implementers are tracking this. It can be through implementation logs, so that would be self-report really. There's trade-offs for all of these, so yes, it relies on an implementer really kind of keenly observing their own behavior and what they've covered. There's direct observations, and in the experiences that we've had, this is sometimes the best information. It's also the most resource intensive and just not practical in every circumstance, particularly trying to do it for every session, for example. But I think some implementers have found that periodic observations can be really helpful. There's kind of doing things after, such as having focus groups and asking implementers about adaptations that they've made or implementation issues. Follow-up phone calls, so we've found that whether it's taking an implementation or observation log, and rather than an implementer filling it, using that as kind of a template for someone who's either a supervisor or someone who's just a coordinator and supporting the program. And of course we have kind of the traditional Fidelity checklist, which can be part of an implementation log or really its own thing. So these are, if you have other ways and you want to add that to the chat box of things that have that you've used that either you've found helpful or have had challenges, please feel free to do that. But I'm going to talk about some of the tools that we have that we found support tracking, and I want to emphasize here that these worksheets really are intended to help practitioners work through a single strategy that you are implementing, and so they really are all connected and flow into each other. Not this one, but some of the other worksheets actually refer to where you can put information from a previous worksheet. So I just wanted to also make that connection. This one here is related to just tracking adaptations. And one thing that we found when there are challenges with tracking what we more broadly refer to as implementation, particularly with our Strive grantees, we had them just track adaptations that they made. And we found that in many cases this was really helpful in helping grantees actually reflect on implementation challenges, even though it was being asked in the form of the adaptation, because obviously implementers were making adaptations because of circumstances they were encountering. I think folks can use this worksheet to a more limited extent, just to track the adaptation and to reflect on whether you'll continue to keep it or change it, or use this as a process, a group process document to talk about, is this a red or green light and why? And that, I think, really is dependent on the time folks have and whether you're talking about, at the organizational level to use this to facilitate something versus individual implementers. I'm going to show you two other examples that we include in the guide itself, and I'd really like to make the point that these are lifted up really to show examples of how you can take essential elements and integrate them into some kind of tracking tool. They may not seem sort of like the ideal tracking tool for your setting. What I'm going to highlight really are observation templates, but they are intended to really, or what I'm intending here is to really show how this could also be integrated, for example, into a implementer log, albeit maybe using different language and different points of reflection. So this one is an example that came from our work with Coaching Boys into Men, our work with Futures Without Violence and University of Pittsburgh. And it's for observers to look at how the implementer delivered the session. And we have examples of both negative group leader behaviors and positive group leader behaviors, really meaning coaches. You could use other language besides negative and positive, but it really tried to make concrete things from the essential elements. So for example, the first one is read word for word from the approach, which at this point in time was considered to be more on the negative spectrum, or less what Futures has now really defined as coaches kind of infusing their own style. A positive would be appear to be comfortable and familiar with the approach. And I'll move to the last one. Another example is part of Coaching Boys into Men is engaging athletes in discussion, but really around these main messages. So a negative would be do not focus discussion on main messages in the approach. And a positive would be an example of discussion was clear and focused, most or all of the time. So you can see that's really conducive to observation, but there are other ways that this could be adapted for more of an implementer log or a reflection after sessions are implemented, potentially in a group setting. This next example is a tracking of delivery characteristics, and this is something that we use in our youth empowerment solution. I believe we may have used it also in Coaching Boys into Men. But this is, Youth Empowerment Solutions is really largely dependent on creating a safe space for youth to talk about youth issues related to their lives their relationship with their communities, and ultimately youth violence. And so there's a lot about the setting that's very important in this program. And so this just lays out some of the things that were defined as essential elements. So the negative would be there were frequent disruptions versus the setting was quiet. The location of the setting or timing of the session made it difficult for participants to attend versus the setting was accessible and the session was at a convenient time. So below there are kind of another or broader way to also make these assessments around whether a setting did or did not support learning through, and again, this would be either through a self-report of an implementer or an observer. So these tools, again, we have some examples in the guide itself, but it's really just a starting place to think about once essential elements are estimated, you can actually develop what are essentially fidelity checklists, but fidelity to essential elements. You could develop tools to be able to track, and they can be as simple or as elaborate as resources allow, and that's what we've found, particularly, for example, in our STRIVE grantees implementing YES. A lot of the implementers actually found them very helpful in both tracking their adaptations, but also kind of bringing that back for quality improvement. But they made some adjustments depending on the time that they had to do those.
There was a great question, Kimberly, about is there anything specific that you've developed around culturally specific communities, thinking like, for example, language access, gender, sexual orientation accessibility, religion accessibility, taboo topics, something like that? I think that's one that so many people are making adaptations to culturally specific communities.
Yeah. So this question is referring more to the adaptations themselves?
I think it's talking about a worksheet for maybe thinking about how you track some of the changes that would be going in some of the cultural adaptation.
So I don't know, Meredith, I'm just trying to think. I guess the first thing that I would say is the worksheets kind of are general enough if those were identified to be some of the essential elements. And I'll give the example from Youth Empowerment Solution, which was developed to work in predominantly African American communities. And one of our sites, actually out in California, was working more with various Latino communities. So they did a lot of cultural adaptations related to that, and I think the process still applied. They were able to use kind of the essential elements. What seemed to be, I don't want to say a little bit different, but of note, and Meredith can weigh in, is those are the kinds of adaptations that tend to come prior to implementation, that folks are thinking about the groups they're working with and the setting, the context. And so the worksheet could be used kind of before actual implementation to think through some of those cultural adaptations that probably impact the entire prevention strategy, not just like one session or one message. It is more of what I would call a cultural adaptation. That said, I don't know that we...
Yeah, we actually do have a worksheet in the guide to help practitioners think through what we call planned adaptations. Think through possible green light adaptations that might come up during delivery versus red light adaptations. So sort of it's designed to help you think on the front end. So if you know you're going to be implementing a strategy with a different population, that might be a worksheet that you should take a closer look at. I think one other thing is to pay attention to is that if you're implementing a strategy with a different population than the one it was originally tested with, is to think through whether that population has some different or additional risk and protective factors that you might need to address that the original strategy doesn't address, and sort of think about how you might adapt the content to address those risk and protective factors.
Yeah. And again, because they're linked, some of that would also come out in that the selection and fit, some of those questions around the risk and protective factors. It's also just helpful for us to maybe think about like future iterations. There may be some more specificity we can bring to that as we learn how people are using them or where they might not quite work, these worksheets.
Great. Well, thank you. I think that was a really helpful question to be able to move forward.
Yeah.
So, Kimberly, I'm aware of our time, and we wanted to ask one last question, and we were both doing it at the same time. So that's why
I know. I was like, that's okay.
Yes. So, based on people presenting this, I would love to just now hear from you as you've been hearing about this guide, and I know you haven't, most of you have not had a chance to read it, but you've been exposed to some of the content. How do you see the information how would you use this information? So I want to get just a sense of, from what you've learned in the last hour and 24 minutes, what are some of the things that information that in this guide that you think how would you think you would use this for your work? So I want to get a sense from you what you're being able to, how do you think that this might be something that will be relevant to the work that you're doing? So I'd love to just hear from you. So I've already heard the template for tracking adaptations will be incredibly helpful for us. So someone's talking about using that template for tracking the implementation. How else is this information going to be helpful for you? I'm new to the field, and that will be helpful. And I think it's important to understand what the essential elements are, and that often it's not been articulated, and people in their training are often trained only on part of it, and that if we can train what those essential elements are is an important way to learn how. I know when I trained staff, when I was in local programs, I would always train people on those essential elements. Doing process evaluations, enhance our own elements of effective violence prevention, which they've created, that they need to share this with their partners, and they're planning to discuss, Mallory's going to discuss at the quarterly statewide prevention meeting. Awesome. So we're starting to see pieces be able to move forward. So I only have 5 minutes left, Kimberly, and I know, Meredith, you've been here and we're part of the process. We had you as a resource as questions came up. But Kimberly, why don't we talk a little bit about some of the different products that are out there?
Sure. Thanks, David. So I mentioned some of the work that we did with Youth Empowerment Solutions and with coaching boys into men through our partners. So through this project, we were, our different partners developed things to actually build on the implementation guidance they had. So I want to say a lot of the value it was in bringing these different stakeholders together. And as an example, Youth Empowerment Solutions, the University of Michigan took a lot of feedback from our STRIVE grantees that were implementing this in their various settings. All 4 STRIVE grantees were implementing it and actually developed adaptation guidance. They identified the essential elements. They developed Youth Empowerment Solutions adaptation guidance, and also these helpful tip sheets, which came directly from the implementation experience, like how do you get teacher feedback. So that's exciting. Similarly, Futures Without Violence, our partners there, worked and developed what they call foul or fair play. So they kind of, rather than red light, green light, developed their version of implementation guidance. And I know here, and I think it's such a great example of how to communicate essential elements in something other than a document. They developed this video in partnership with coaches and domestic violence advocates who were implementing this, as well as the Pittsburgh Pirates they partnered with, to really lay out how the essential delivery elements in particular of coaching boys into men. So those are just 2 examples I want to highlight. And then for our part, we've done a lot in applying this in our context. We're looking at practice-based strategies for sexual violence prevention. And we're actually using the what, how, and who for strategies that have not yet been evaluated, but to help articulate what are the essential elements to make them easier to evaluate. We are integrating this in our the implementation guidance for our technical packages, which I showed you earlier. And of course, through our work with Prevent Connect, we have been, along with Prevent Connect, working on peer forums and various trainings for practitioners, as well as we've integrated this work in our training with the Air Force on how to put prevention into practice. Actually, the Division of Violence Prevention is working on training every installation all over the world, so that's very exciting. And with that, I think we just want to acknowledge the folks that were really integral to this work, many people. And in particular, I'd like to note, Laura Leviton, who was our champion at the Robert Wood Johnson Foundation, but many of our partners, and again, to acknowledge Leah Perkinson, who is a key part of our team. So thank you so much for your time. And I just want to note that this is not only available on the web, but will be available in hard copy probably within the next month. So we'll make those available.
Great. And I want to thank Meredith and Kimberly for joining us today. Here's the information. The point of contact would be with Kimberly, and this is Kimberly's email address. I do want to note that for this web conference, I originally said we were from Alaska to Miami, but I see India and Hawaii also joining us. So just to get the people to see so many of you who are here and really interested in the different topics that we can be able to have. So I want to thank you all for joining us at today's Prevent Connect web conference. And as we discussed essential elements, we encourage you to join us for future Prevent Connect web conferences and be in touch with us. You will receive an evaluation in about 15 minutes. So please go ahead and fill that out. That provides us very important information. Thank you all for joining us today. We hope you have a good day and wish you all the best. I'll keep the text chat open for a couple minutes. This concludes today's Prevent Connect web conference.